So I think a couple of you guys have been in some of our previous sessions, but we are a large academic medical center in the DFW area in Texas. We are ambulatory magnet recognized, which is very exciting. We got our first ambulatory magnet recognition in 2021, so we are very happy about that, and it was a big accomplishment. Thank you. I see some applause. We have over 90 specialty clinics and primary care clinics in the DFW area. We have the majority of them are our main campus in Dallas, but we also have about 9-10 regional centers. I don't know, the number keeps growing. It's hard to keep up. So over 2 million visits annually. And then we have over 1,000 ambulatory staff, and about 400 of those are medical assistants. Okay? So that's a little bit about who we are. So how many of you guys have all of your medical assistant positions filled? Yeah, there's no prizes. I don't have any prizes for this one. So as you probably know, right, staffing is not just a nursing concern, right? We're not just having problems with nursing staffing and filling those nursing voids, right? We also are trying to fill those voids with medical assistants and other unlicensed assisted personnel. So it's one of the fastest growing occupations in the U.S., and projected growth between 2016 and 2026 was about 30%. High turnover rates. Do you guys have high turnover rates with your medical assistants? I see some hands raised. Yeah. So they're hard positions to fill. And then once you get them filled, how do you retain that staff? How do you retain those high quality employees and make sure that they're prepared for the complex care that's being done in the ambulatory setting? And a lot of the MAs, because the MA practice at my organization is not the same MA practice at your organization. It varies from state to state. It varies from organization to organization, right? So at our job requirements, so the job description for our certified medical assistants, and in our organization, about 90% of our MAs are certified. So our job description says that an MA has to have graduated from an MA accredited program. They have to have a certification from 1 out of 5 certified bodies. They have to have BLS. And also, clinical experience is not required, but it is preferred. So how do they get clinical experience? How do you fill these positions that are high turnover rates when we have those qualifications? So we're going to talk about how we found, hopefully, some innovative solutions to fill those gaps. The numbers are kind of dim here, but you can see our turnover rates. These are our turnover rates for calendar year 2021. Started out at 19% in January, and then it went up to 33%. So challenge, right? High turnover rates, we've already mentioned that. I don't have to tell you what the clinical benefits of hiring an MOA is, right? What they do in our clinics. But what they allow nurses to do is they allow nurses to practice at the height of their licensure, right? Nurses can delegate unnursey things to MOAs, right? So nurses can do things that they went to school for. Telephone triage, assessment, patient education, evaluation, right? So they can delegate those things. So when folks work at the height of their licensure and they work at the height of their certification, that leads to staff satisfaction, leads to staff retention, and then that translates to patient satisfaction, and then patient safety as well, right? So that's our goal, right? Good, effective, safe patient care. So, like I said, my practice, my MOAs don't practice the same as yours. I'm sorry, they're not all mine. I shouldn't say that. But our organization's MAs do not practice the same as yours. But you know, they are an integral part in clinical practice in our clinics. A lot of times, that's the first interaction that our patients have with the clinical staff, right? The MAs room the patients, and they do a various roles in the clinic, and they have a broad list of tasks and skills and requirements that they do in the clinics. So anything from rooming patients, helping with procedures, phlebotomy, medication administration, depends on what state you're in and things like that. And we'll talk about scope here in a minute. So let's talk about our residency and how we implemented it and what our goal was and a little bit of our partnerships with some local organizations. So the residency began with a grant from the Department of Labor. So in 2020, the Department of Labor provided grants to industries that normally don't have apprenticeships. So healthcare, hospitality, and some other examples. Truck driving I found was interesting as well. So to get those people in the workforce and develop them into entry-level positions for folks that maybe wouldn't have those opportunities to be in jobs like that. So we partnered with our local hospital council, our DFW Hospital Council, and then our local community college. If you guys are from DFW area, Dallas County Community College, which is now Dallas College. So we partnered with those folks, and they really assisted us in developing this program. They helped us with the funds. Any of you guys that have partnered with the government, you know that there's a lot of paperwork, a lot of tracking. So they helped us with all of that. And you know that that was a big lift for us. So it took a lot of that weight off of our shoulders to really help us. And they were like, okay, we need this stuff done. This is the due date. This is when we need this done. And so really helped guide us through that. So we could really focus on the curriculum development. And we're educators, so really allowed us to develop the education and the training part of that. So Dallas College, our partners, they have an existing MA program. So we were able to take that information and really develop that to our needs of our clinical staff. And I'll talk about curriculum development here in a second. Another thing is that I don't hire medical assistants, so I don't know where to look for these folks. So we partnered with our talent acquisition, and we have talent acquisition, it's hard for me to say, we have recruiters that, that recruit specifically for medical assistants in our clinics. So we partnered with those folks, and where do we recruit these people? Where do we, what's the best place to find candidates for this residency? And then we developed a job description for these folks. And the job description, you remember the requirements for our certified medical assistant. So the qualifications and the requirements for this was, you had to be 18 years of age, you needed a high school diploma or an equivalent, and just an interest in being in healthcare. Those are the three things. We'll teach you the rest. We'll get you BLS certified, we'll get you into accredited medical office assistant, and then we'll get you that clinical experience that you need. So it was a lot easier to recruit for this role and hire for this role than it was for a certified medical office assistant. And then the third part was really developing clinical rotations with experienced preceptors, MA preceptors in our clinics that were willing to train these residents and really enculturate them into our system, into our organization. So the residency development, the curriculum. So like I said, Dallas College already had a MA program. And they really met with us and sat down and said, what do your MAs do in your organization? Our MAs don't do a lot of billing. They don't do a lot of administrative tasks. They don't do coding. They don't schedule. Our MAs are really focused on direct patient care. So we were able to take that curriculum and really hone it down into those skills. As part of the residency program, they also sit for a certification. That's part of the residency program. And so the certification that they sit for is the National Health Career Association certification. So they were also able to take that content from that exam and incorporate that into the curriculum as well. So the program is a 12-month program. And for the first 12 weeks, they are in didactic training at Dallas College by Dallas College faculty, 40 hours a week, 5 days a week. It's very intensive.